Hello and welcome to this video on the genomics of rare diseases and orphan drugs. Rare diseases affect millions of people worldwide, and many of them have a genetic component that is not well understood. But thanks to advances in genomics, we are now able to better understand the genetic basis of these diseases and develop targeted therapies to treat them. So, what exactly is genomics? Genomics is the study of the entire genome, which is the complete set of DNA in an organism. By studying the genome, we can identify genetic variations that may be responsible for disease. In the case of rare diseases, genomics can help us identify the genetic mutations that cause these diseases. Now, what are rare diseases? A rare disease is defined as a condition that affects fewer than 2 lakh people in the United States, or fewer than 1 in 2,000 people in the European Union. There are over 7,000 known rare diseases, and many of them are caused by genetic mutations. Unfortunately, because rare diseases affect so few people, they are often overlooked by pharmaceutical companies, which focus on developing drugs for more common diseases. This is where orphan drugs come in. Orphan drugs are medications that are developed specifically to treat rare diseases. Because there is little financial incentive for pharmaceutical companies to develop these drugs, governments often provide incentives such as tax credits and grants to encourage their development. But how exactly do genomics and orphan drugs work together? By identifying the genetic mutations that cause rare diseases, we can develop targeted therapies that address the specific cause of the disease. This approach is known as precision medicine, and it is revolutionizing the way we treat rare diseases. For example, consider cystic fibrosis, a rare genetic disease that affects the lungs and digestive system. By identifying the specific genetic mutation that causes cystic fibrosis, researchers were able to develop a targeted therapy that addresses the underlying cause of the disease. This therapy, called Kalydeco, has been shown to improve lung function in patients with cystic fibrosis. In conclusion, genomics is helping us better understand the genetic basis of rare diseases, and orphan drugs are providing targeted therapies for these diseases. While there is still much work to be done, these advances offer hope for millions of people worldwide who are affected by rare diseases. Thank you for watching, and we hope you learned something new today.